Hello, my name is Elizabeth and I'm an occupational therapy assistant student at Bryan and Stratton College in Wisconsin. Today I will be going over seated exercises that you can do at home to aid with posture and spinal support. This video is designed to target the pelvis and the spinal column to help realign your body to a functional and safe position. Although this video is for any viewer who would like to improve their posture, these exercises can also be beneficial for individuals who experience decreased trunk strength, individuals who sit for most of their day, such as those clients that are restricted to wheelchairs, individuals who cannot perform standing exercises safely, clients with back problems or spinal diagnoses that prevent proper positioning while sitting, individuals with breathing complications such as hyper or hypoventilation, and individuals who have decreased energy conservation. For safety purposes, it's important that you perform these exercises at your own pace and at a level that is comfortable for your body. You should have notification from your physician that activity is allowed, and I advise that you stay seated at all times during this video. Please also remember to breathe while you are completing the exercises. A helpful tip to make sure your breathing is fluid and uninterrupted is to count out loud. Before we jump into these exercises, let's take a look at what proper sitting posture looks like and why it's so important for our bodies to practice good alignment. Proper positioning and posture while sitting can have many effects on the body that we don't even realize. Some of the advantages of practicing these exercises includes reduced lower back pain, fewer or less headaches, increased energy levels, less tension in the neck and shoulders, decreased risk of abnormal wearing on joint surfaces, increased lung capacity, and improved circulation and digestion. These benefits can be reaped by anyone who finds themselves in a seated position for long periods of time. Some studies even show increased benefits to good posture when individuals who are independent enough take breaks from sitting after long periods of time. Getting up to walk around every hour can have benefits for the spine, pelvis, lungs, heart, and even the brain. A small walk to the drinking fountain or to grab a snack can give the body a rest from any awkward positions it finds itself in. Initially, you may begin to think that the way you sit isn't improper or awkward, but comfortable for your body. Although, over time, researchers suggest that sitting in an awkward position can in fact be harmful on your body, causing back pain, irritability, decreased lung capacity, and even misaligned joints, all of which originate from our back and pelvis. Let's take a moment to review a little bit of anatomy of the body and its form while sitting down. In the therapy world, we follow the rule of 90s. In order to understand this principle, it's important that we focus on the alignment of the pelvis and spine in relation to our distal or outside limbs. The pelvic girdle, which is composed of the sacrum and the ilium, gives us our base of support while we are in a seated position. It provides sitting balance that gives you stability, coordination, and proprioception, or the awareness of your body in space, and aids with weight shifting. The pelvic girdle is also known to have two defining tilts that can make sitting balance difficult on the rest of the body. An anterior or front side of the body tilt occurs when there is muscle imbalance due to sitting for too long in one position without shifting or correcting. This can be caused by decreased strength in the core, glutes, or hamstrings, and tightness in the back extensors and hip flexors. An anterior or front tilt causes your tailbone to stick out. Think about how a duck walks. On the other hand, a posterior or the back side of the body pelvic tilt may also occur in some individuals and is also due to muscle imbalances. A posterior tilt occurs in the opposite manner where there is tightness in the core, glutes, hamstrings, and weakness in the back extensors and hip flexors. In this case, the tailbone is tucked under and the spinal column shows increased flexion or a slouching position. If you are an individual who experiences a pelvic tilt due to other complications, know that there are adaptations that can be made to your sitting surface that can help. As I mentioned earlier, pillows or blankets can be excellent tools to help find proper base of support. If you are restricted to a wheelchair, there are many seat cushions that are also available to use and can help with either directional tilt. But what does all of this have to do with sitting? Let's go back to the rule of 90s I mentioned earlier. When you sit, you want specific angles in your body to line up to a 90-degree bend. Ideally, we see these 90-degree bends at the pelvic girdle, the knees, and the ankles. In order to make this happen, we want to make sure our lumbar or lower spine is supported against the back of the chair. This is where props come in if extra support is needed. You also want to make sure your knees are about an inch away from the lip of the seat of your chair and your feet are flat on the floor. If any of this does not seem accessible to you, that means it's time to adapt. Placing a stable stool under your feet can help increase the bend in your knees and help keep your feet flat. But make sure it doesn't interfere with the 90-degree bend at your waist and your knees don't lift or rise above your hip crease. If this occurs, a cushion can aid in the angle at the pelvic girdle. Be sure to ask your therapist or physician if there are other complications preventing you from finding your best rule of 90, and know that it can take a little tinkering to find the just right fit for you. Now that you have a better understanding of how your anatomy plays a role in posture and what we're aiming for, let's practice a few exercises that can improve your active range of motion and strength to increase proper sitting posture. Here are some materials you'll need before we get started. A chair with arms and a back for support, any props such as a pillow or blanket if you'd like to make adjustments to your form, and a gait belt if you know that your trunk strength is weak and require assistance to stay safe in the chair. First, place yourself in the rule of 90 as best as you can using any props needed. Sitting up as tall as you can, imagine pushing down into your tailbone and lift into the crown or top of your head up towards the sky. This will help elongate your spine and create space between each vertebra. Next, place both hands on top of your knees or the armrests if that feels more supportive. Take a deep breath in and push your chest forward and tilt your tailbone back to create an anterior tilt with your spine. If you can lift your gaze up towards the ceiling to stretch the front of your neck, try to do so. When you are ready to exhale, slowly start to pull your belly button back towards your spine and round your shoulders like a Halloween kitty cat. Tuck your chin into your chest to protect your cervical or upper spine. Keep your abdominal muscles active and tight here and feel your shoulder blades start to pull apart. When you are finished with your exhale, start to extend back again and release to flexion on an exhale once more. Continue these seated flexion and extension waves 10 times each direction and notice the direction of your pelvic girdle and its soft adjustments beneath you. Feel free to count out loud to keep track and remember to breathe. When you are down, find the rule of 90 and see if you can sit a little taller while engaging your core muscles. For this next exercise, I will demonstrate two variations that are available. After watching both options, pick the exercise that is safest for you or your client. Start by reaching both arms in the air overhead if possible. Begin to reach your left arm as much as you can over to the left side without losing your balance. Slowly return back to center and reach your right arm over to the right side as much as possible without losing balance. Next, bring both arms down to the sides and do the same on the left and right, this time reaching down to each side. After you're done reaching down on each side, return your arms up overhead and start again. That was one repetition. Complete 10 of these star reaches, always returning to center slowly to work on trunk control and seated stability. Feel free to pause the video at any time to take a break. Here is an example of a modified version of star reaches. Begin by reaching one arm in the air overhead. With the other hand, hold onto the arm of the chair for extra support. With the arm that is in the air, begin to reach off to the side. Slowly return back to center. Switch hands and take a breath to find your stability. When you are ready, reach your other hand out to the side and slowly return back to center. Again, take a breath to find your stability. Next, reach your first hand down to the side over the arm of the chair and hold on to the other arm with your opposite hand. Begin to reach down to the side while holding on to the chair. Only reach down as far as it's comfortable for your body. Using your core, slowly return back to a tall seat and switch hands. Reach your other hand down to the other side of the chair, hanging onto the arm of the opposite side. Again, slowly return back to a tall seat and take a breath. That was 1 repetition. Complete 5 to 10 of these star reaches, always returning to center slowly to work on trunk control and seated stability. When you are done, find the rule of 90. Now that you've seen each option with modifications, rewind the video and complete the best exercise for you. For this next exercise, you will need the arms of your chair. Begin by reaching your right arm up in the air, then crossing it over and twisting your spine to the left, placing your right hand on the left armrest. Hold for 3 seconds, then return to center. Reach your left arm up in the air and cross it over to the right, twisting in the same direction. Again, holding for 3 seconds and returning to center. Complete 5 on each side, always returning back to center after each twist. Try to focus on reaching your arm as high as you can to elongate the side of your ribcage and lift away from the seat to create length and stretch for the core to move. If it's easier, think about your spine as a spiral staircase, starting from the bottom of the staircase or your pelvic girdle and winding all the way up to your neck. If it's in your practice today, feel free to bring your gaze over your back shoulder when you twist to add length into your neck. When you are done, find your rule of 90. Now that you've worked on warming up the spine, it's time to focus on the other aspects to help posture. Start by reaching both arms up overhead again. Take a big breath in, and when you're ready to exhale, goal post your arms so your elbows are in line with your shoulders. Take a moment to notice your core again. Is your chest sticking out, or can you activate your abdominals to help you pull your shoulder blades closer together? On an inhale, reach both arms up overhead again. Repeat this 10 times, focusing on pulling your shoulder blades into your back pockets and breathing through each repetition. If it helps, think about lifting the bottom of your ribcage away from the tops of your hips on each inhale. When you're done, find the rule of 90. This last exercise will focus more on the hips and the hamstrings, or backs of the legs. This exercise may require you to scoot closer to the edge of the chair. Please remember safety first and maybe have someone nearby or a surface to hold onto, such as a table, for help if you experience decreased balance. I will again demonstrate 2 variations available for this exercise. After watching both options, pick the exercise that is safest for you. For this first option, begin by placing your right ankle on top of your left knee, similar to a figure 4 seat. What I mean by figure 4 is that your knee and your bottom leg look like the number 4. Once your legs are in position, place your hands on your top foot and knee for support. Lengthen your spine and begin to lean forward. When I say lean forward, I do not mean round into your shoulders. Try to keep a straight, flat back and use your hips as the hinge point. Also, note that I'm not placing all my weight into my hands and putting pressure on my leg joints. If you feel this is easy for you, feel free to make it a little more difficult and place your arms over your chest to challenge your core even further. After a couple rounds of breath, slowly return yourself to a tall seat and begin again. If this feels like a lot for your hips, you can always extend your bottom leg forward a little further to increase the angle between the bottom of your stomach and the top of your thigh. Repeat this exercise 10 times or do as many as you can safely and return to the rule of 90 when you're done. If this first option doesn't seem like the right fit for you, try this variation with modifications instead. You will need a steady surface to lean on in front of you where your legs can extend underneath in addition to your chair with armrests. Begin by scooting your bottom forward halfway down the chair. Place both hands in front of you on your steady surface and prop your back up nice and tall. Extend one leg out long and begin to lean forward. Just like the first variation, don't round into your shoulders, but lean into the hips. If you can, point your toes towards your face to add length into the backs of your legs. Take a couple of breaths to feel the stretch, then slowly start to sit up tall again. Repeat this modification 7 times on this leg, then switch sides. You can always scoot your bottom closer to the edge of the chair, or push your steady surface further away from your body to begin. Now that you've seen both options with modifications, rewind the video and complete the best exercise for you. Finally, start by completing these exercises 3 times a day or as a break from sitting for long periods of time. Once you start to feel comfortable with them, you can increase the intensity to 2 sets of each repetition. Start with the first exercise and go through each one with full repetitions. Once you've completed a full round, start with the exercise 1 again and run through them each as a circuit. If you have any questions about the exercises in this video, feel free to leave a comment below or contact your treating therapist or physician for help. Remember to always put safety first and listen to what your body needs. Modifications and adaptations are always welcomed. Therapist, we would appreciate your feedback regarding implementation of this video. Please take a few minutes to complete the brief survey using the provided link below. I hope you found the information in this video helpful for your posture and learned something new. Thank you. Until next time.